Chapter 8: The Role of Data in Public Health Source. Introduction to Public Health by Mary-Jane Schneider, 2021, Jones and Bartlett Learning. Just as doctors monitor your blood pressure or temperature to track your health, public health professionals rely on data to monitor the health of entire communities. In this video, we'll explore how data is collected, used, and protected in public health. You'll learn about the US Census, vital statistics, national surveys, and how data drives policy, planning, and response to public health threats. Why public health depends on data. Data is the foundation of public health practice. It allows us to track health trends, identify high-risk populations, detect emerging threats, plan and evaluate programs, allocate budgets and resources. Data collection happens at every level, local, state, and federal. These statistics guide everything from vaccine distribution to emergency response. The National Center for Health Statistics, or NCHS, is the federal agency responsible for collecting and reporting health data in the U.S. It gathers data in two ways. 1. Vital statistics like births and deaths collected from local and state governments. 2. National surveys such as health interviews and nutrition assessments. This data fuels epidemiologic research, policy development, and program evaluation. Vital statistics, birth and death certificates are the most complete and reliable health data we have. Birth certificates include demographic info from the mother. Medical info from the hospital. Death certificates include cause of death, contributing conditions, demographics of the deceased, but even these records have limitations. Death certificates may list inaccurate causes. Social stigma may affect how suicides or HIV/AIDS deaths are reported. Inconsistent autopsy use contributes to diagnostic uncertainty. The US Census and the American Community Survey. To calculate rates like mortality or disease incidence, you need a denominator, the size and makeup of the population. That's where the US Census comes in. Conducted every 10 years, it provides data on age, gender, race, and ethnicity. Geography, housing and income. The American Community Survey, conducted annually, updates this information between censuses. It helps with everything from school zoning to hospital planning. Without the census, we couldn't measure or compare public health outcomes across states or communities. National health surveys. The NCHS and CDC conduct several large-scale surveys to track health status and behaviors across the country. Key examples: NHS, interviews about chronic illness, access to care, injuries, and more. HAINS combines interviews with physical exams and lab testing. BRFSS, telephone surveys on lifestyle factors, diet, exercise, smoking, seatbelt use, and screenings. While BRFS reaches far more people, NAINS provides more objective data, since people tend to underreport behaviors like weight or smoking. Data from other agencies. Other federal agencies also gather valuable health data. The EPA monitors environmental hazards. The National Cancer Institute runs SEER, tracking cancer trends. The FDA collects data on adverse drug reactions. CMS has data from Medicare on care quality and cost together. These datasets provide a comprehensive view of the factors that affect population health. Why we need so much? Some people ask, do we really need this much data? The answer is yes, because without it, we can't recognize early warning signs. We can't prioritize resources effectively, and we can't evaluate whether programs are working. From pandemic response to prenatal care, data drives every major public health decision. Data accuracy and limitations. Still, all data has limitations. The census undercounts some populations, like the homeless or undocumented. Death certificates may misclassify the cause of death. Surveys can be biased if people skip questions or give false answers. To improve accuracy, states now use electronic records that flag incomplete or inconsistent reports. New tools in public health informatics allow faster data sharing and real-time surveillance. Confidentiality and ethical data use. Collecting data on people raises questions of privacy and ethics. Agencies protect confidentiality by removing identifying information, requiring IRB approval for researchers, using secure systems for storing and sharing sensitive data. Special rules were developed for HIV/AIDS reporting to protect people from stigma. While data is essential, protecting individuals is non negotiable in public health. Conclusion data is the heartbeat of public health. It helps us detect problems, guide solutions, and evaluate success. Whether it's monitoring infant mortality or tracking vaccination rates, data tells us what's happening, who's affected, and what needs to change. As technology advances, public health informatics will continue to expand access to timely, accurate, and secure health data. Call to action. This video is based on Chapter 8 of Introduction to Public Health by Mary-Jane Schneider, 5th edition, 2021, Jones and Bartlett Learning. If this helped you understand the role of data in protecting population health, share it with others. And let us know in the comments. What kind of health data do you think is most valuable and why?